Everybody's doing it. Everybody's on it. Yes, I'm talking about weight loss injections. People might know them as Ozempic, Mounjaro, Wegovy. These are a class of drugs called GLP-1 agonists. What does it mean for your beauty, and how are we going to fix Ozempic face? Let's get into today's topic.
You Are Beautiful, podcast with Jae Kim, ND.
Welcome to the You Are Beautiful podcast with Jae Kim, MD. I'm your host, Dr. Jae Kim, a facial plastic surgeon, and I'm on a mission to make the world a more beautiful place. I want to start with you. There are 3 undeniable truths that you must embrace to achieve this mission. The first is that you are beautiful. The second, you are unique. And the third, you are worth it. Let's talk about all things Ozempic face. It's real, guys. Ozempic face is real. And Ozempic works in 3 ways. And I'll just say Ozempic, but I mean all of these GLP-1 agonist injections. So first, it works on your pancreas. It helps release insulin so that your body lowers the blood sugar. Second, it works on your stomach by giving it a signal that you are full, that you are not hungry anymore. And third, it works on your brain to say you are not hungry. You don't need to eat anymore. In terms of weight loss, this has been quite a breakthrough. And even people who have type 2 diabetes, this was the original indication for this class of drugs. People who have type 2 diabetes experience a significant lowering of their hemoglobin A1C, which is a measure of long-term blood glucose control, and they also lost weight. So the aesthetic industry ran with this side benefit of losing weight, and here we are in 2024 talking about Ozempic face. One of the consequences of being on a GLP-1 agonist like Ozempic is that as you lose weight, you lose volume in your face. And I tell patients this all the time. When you are considering removing volume from the face, there is a potential of looking older sooner. And this is of concern, particularly around the eyes and even buccal fat. And you'll see people who have Ozempic face who have lost significant amounts of volume on their face. And the locations on the face that I look at are temples. And so instead of full temples, what you get are concave, hollowed out temples. In addition, you might see certain areas of fat around the cheeks, especially the front of the cheeks and under the cheekbones, where people look more sunken. The other place you might notice it is along the neck, where if you lose superficial volume here, you might look a little pruny, kind of like a deflated balloon. In general, there are 3 ways to replace volume in your face. I'm going to start with the first one, which is filler. Filler is made up of hyaluronic acid or of calcium hydroxyapatite. In 2024, there are many different fillers from more than a few companies, and they range from the thick and strong to the real thin and flexible. And so when it comes to volume in certain areas of the face, and if you lose a significant amount of volume, what you're going to want in terms of filler is on the side of thicker and maybe stronger. And in terms of technical terms, we call that G prime, which the higher the G prime, the more it's going to give you that appearance of lifted or structured or more voluminous. Like I mentioned before, there are certain areas where Ozempic face shows a particular loss of volume around the temples, just below the cheekbones, and sometimes around the pre-gel and the marionette lines, and also maybe a little bit of pruning because of superficial fat loss in the neck. Where filler can help with that, I think filler is particularly good for helping the hollow along your temples. If you inject it really deep, kind of basically almost deep to the muscle, your chewing muscle right here, the temporalis, you can create a more flat or even rounded look to help with the hollowness. In terms of Below the cheekbones in this buccal region, if you lose a lot of volume there, filler is not going to help you volumize that area. The thing is, filler works best when it's stacked on top of a more robust structure, like a strong muscle or even a bone. Here, on the buccal region, you have nothing but skin and gum. And so when you put volume there, in terms of filler, what it can do is it can help bring out the cheek from the outside, but more likely what will happen is that the cheek and the inside will get volumized. And there's no aesthetic benefit to that at all. You might end up biting your gums more. In terms of marionette lines, pre-jowl filler is a good option. In terms of results, they're instantaneous, and you will realize these results for a good year, maybe 18 months, depending on the type of filler used, depending on how much filler used. Side effects are rare, but they can happen. If, while injecting filler, you are compromising blood supply to a tissue or to the skin, what can happen is that blood supply can get cut off, and you can have necrosis or death of that tissue. Again, this is rare, but it is a serious potential complication. So you have to trust that your aesthetic professional doing these filler treatments is going to be safe. The other potential side effect is that you can get a little bruising at the site of injection. Now, some people use needles to administer filler. Some people use cannula to administer filler. I don't think there is one right way to do it. And for a particular anatomical area, some people can use both. I and the injectors I know use a combination of both, depending on the situation. In terms of downtime, you can experience maybe that day or the next a little bit of bruising, a little bit of swelling. It's going to go down pretty quickly. And so you're free to go about your daily activities probably by the next day. You're definitely not going to go to your Pilates or yoga or super strenuous exercise class that day or the day after. In terms of number of treatments, this can vary. I never say that filler treatment is a one-stop shop, because there is a certain amount of building that you have to do structurally, and in terms of the amount of volume that you might want to replace. If your Ozempic face is quite severe, then it will take definitely more than one visit to the office to have filler procedure to kind of build up that volume. So caution when you think that one visit's going to do everything. It's just not. And most experienced aesthetic professionals will tell you that. In terms of building up volume with filler, it is not a one-time visit, but it is a series of visits to help basically rebuild what has fallen and what has sunken. The second way to help revolumize Ozempic face is with a biostimulatory injection, kind of like Sculptra, kind of like hyperdilute radius. Sculptra is poly-L-lactic acid, which is a chemical that helps to stimulate your collagen production by causing inflammation. This is a controlled inflammation that is placed in the areas of volume loss. This was originally indicated in the 1980s for people who had HIV-related wasting syndrome called lipodystrophy. And so in terms of volumizing, it's not instantaneous like filler injections are. I think Sculptra is really good for areas like filler hollows. I think it's much better than filler for places like the buccal hollow. And in terms of marionette lines, nasolabial folds, pre-jowl sulcus, and even some of the valleys here in the neck soft tissue, I think Sculptra can be a very good option. In terms of wear, basically anywhere on the face and neck that has lost volume is a safe area for injection. This is not approved by the FDA, either for filler or for Sculptra, but this is common practice for aesthetic professionals who commonly use these products. In terms of results, you're not going to see results immediately with Sculptra or any other biostimulatory injection. You're going to watch grass grow. Basically, it'll be at least 2 months before you see any appreciable volumization along any area of treatment. So if you think about how long that 60 or 61 days is, and you try to see a progression between day 34 and day 35, for example, you're not really going to see all that much difference. You have to wait at least a couple months to see any appreciable difference in the volume of your face. Potential side effects include bruising at the site of injection. They include a little over stimulation, which can cause a little bit of being overdone, just like filler, but to a lesser extent. With filler, there is a way to undo some of the treatment, and there is a filler melting injection called Hylenex. With Sculptra, there unfortunately is not. So there's a big difference between those two in terms of being overtreated and there being a way to remedy that. In terms of downtime, Sculptra downtime is about the same as filler downtime. The injectors I know and the way that I learned how to administer Sculptra, I use cannula more than I would for filler. That does not mean necessarily that that's a better way. It's just the way that I'm comfortable with and my team is comfortable with. And so what that means usually is less bruising. However, if you are treating multiple areas multiple times with Sculptra, of course, there is a slightly increased chance of bruising than if you were to treat only one area. So that's downtime. And then the number of treatments, usually at least 2 treatments, at least 2 visits to the office for Sculptra treatment. And if the hollowing is very severe, you're probably looking at 3 to 4 treatments, and that's about 2 months apart, each of them. And after that, let's say a year later or 18 months later, you want a little tune-up. That's, of course, something that your aesthetic professional can do. Sculptra results can last 2 years, maybe longer. That's as far as the research timeline went in terms of the efficacy of Sculptra. So when you look at the efficacy study, still about 2/3 to 3/4 of people who had Sculptra treatment, 2 years later, they were still happy with the results. So it's not going to fall off a cliff after 2 years just because the data weren't recorded. It's just that you can only carry on a research study for so long. So in terms of Sculptra, I do think that at least 2 years of efficacy of good results, you can enjoy that for a good long time. The third way to volumize Ozempic face is with your own fat. Now, if you've lost weight, do you have fat left? Yeah, you do. There will be no point at which you reach 0% body fat because your body needs fat. And so where do you get the fat from? Well, from your own body. You're not going to get it from somebody else's body. You're not going to get it for a cadaveric specimen. This is your own body, your own tissue being removed from one area to be put into the face so that you get volumized. Common areas for getting the fat from you include around your love handles, around your tummy, around the outer and inner thighs, sometimes just inside of the knees, so near your patella, near the far end of your femur. So these are all good areas for good quality fat to be harvested and processed so that it becomes basically the most natural, most dynamic, most alive filler material you could have. Can you see I'm excited about fat? So in terms of where on the face and neck you can inject fat, it is safe basically almost anywhere. And let's just start from your temples. If you have a good amount of fat and you inject it around the temples, you can have a nice flat or even convex look to help fix the concavity that made you look older. In terms of in front of the cheekbone, so like your lower eyelid, cheek junction, that's a great area for you to have fat. And even along the tear trough area, I think fat is much safer than filler in that area because fat's going to move in a dynamic way with your lower eyelid tissue. That's a whole other topic for another time in terms of lower eyelid rejuvenation and why I shy away from filler in that area. But I think fat is the best rejuvenator of this lower eyelid, upper cheek area. In terms of nasolabial folds, marionette lines, pre-jowl, in terms of superficial hollowing of the submental fat, I think your own body fat is a great way to help rejuvenate that area. In terms of results, this is the big key. Fat is alive and dynamic. It came from your own body. So unlike filler, unlike Sculptra, there is a small chance that some amount of fat may not take. And so this is your own live tissue that you are removing from one part of your body and putting it into another. Therefore, your own body's blood supply has to incorporate the fat. The good news is that your face has relatively a good, abundant blood supply, and the chance of fat grafted into the face and neck area has a very good chance of taking. So in terms of results, you'll be swollen for the first few days, and then after that, you might see a little bit of bruising too. Overall, I think that the patients who do have fat grafting with us have had a very smooth experience in terms of recovery and in terms of results. So side effects, I alluded to that before, is that the viability of the fat is not 100% guaranteed. And so every fat cell that gets grafted into the area of volumization, not every one of them may survive. But again, the blood flow to the tissues of your face is pretty robust, so that chance is pretty high that it's going to take. In terms of other side effects, there's a small chance that a small cluster of fat may be too thick or not processed finely enough. I think that we minimize that issue by processing it as finely as we need to process it so that it does not stay lumpy bumpy. In terms of downtime, again, a few days, probably a little longer than filler, probably a little bit longer than Sculptra, but overall, I think in terms of downtime, what people expect after having fat removed from one part of the body and grafted into another, I think the downtime is relatively low. You can return to most physical activity besides strenuous exercise by a few days afterwards. Again, light walking. Just don't be immobile, because being immobile actually increases complications after a procedure. So that's a whole other topic. But needless to say, you don't want to go run a marathon after you've had fat grafting. The other thing that is unique to fat grafting recovery is that you probably want to increase just a little bit intake of fatty food. And so if you eat too healthy and if you don't eat enough, what could happen is that your body returns to a catabolic or a breakdown state where the preservation of fat is not consistent with the body's metabolism. So if you're in a catabolic or breakdown state, your body's going to want to break down fat, even the fat that has just been grafted to your face. The key to this is to increase your intake of fatty food. In terms of number of treatments, usually people are one and done. However, after 6 months, after a year, if you want another tune-up, of course, you're more than welcome to have another tune-up. And this should last anywhere from 10 to 15 years, as long as you don't continue to lose a significant amount of weight. So the same metabolic processes that happen with Ozempic face, even after fat grafting, that can affect your fat grafting result. One other hot take, and this is related to GLP-1 agonist medications and when it comes to surgical procedures. So if you are going for anything where that requires anesthesia, whether it's a colonoscopy, whether it's a more invasive surgery, basically anything more than just using numbing shots, you have to be off your GLP-1 agonist. Now, current guidelines may say 1 week or 2 weeks in terms of staying off the medication. Now, the reason this is so important is that when you go to sleep under anesthesia with or without a breathing tube, there is a risk of the contents of your stomach coming up and into your mouth and into your airway, and that can cause a pneumonia, which can be really bad. The key to this is to stop your GLP-1 medication at least a couple weeks before any scheduled procedure that requires anesthesia. Let's say you're having dental extractions and you need sedation at your oral surgeon's office. Even something like that, you want to be off your GLP-1 medication. So for filler and for Sculptra, this is not a concern because you're totally awake, you're not having any other medications under anesthesia in order to get these treatments. But when it comes to fat grafting, if you have any anesthesia or sedation medications on board, you want to be off your GLP-1 because you don't want to get aspiration pneumonia. So again, there are three modalities that you can use to help volumize your Ozempic face. And if you're undergoing any kind of procedure that involves sedation or anesthesia, you want to be off your GLP-1 medication for a couple weeks beforehand so that your gastric emptying is sufficient and safe. This issue will be around for quite a while. GLP-1 agonists are not going away anytime soon. And so Ozempic face, we're going to see it a lot. And so how you want to treat your Ozempic face is up to you. This is some amount of education, and this is not a personalized recommendation for your situation, but these are some bullet points in order to help you decide how you want to treat your Ozempic face if that's what you would like to do. So again, thank you for joining me on this episode of the You Are Beautiful podcast. Remember to leave a comment. We love your feedback in terms of what you thought of this episode and other episodes you would like to have in the future. Again, remember these 3 undeniable truths. You are beautiful, you are unique, and you are worth it. Until next time, take care.